Welcome to the Potter Blog site, January 15, 2016. Centers for Disease Control preparing for a massive Ebola outbreak in the United States within 30 days. That's the time frame they have set for this Decipher Ebola platform. Basically what this is a massive database that tracks everybody and everything who might have Ebola, looks at the DNA of the Ebola virus that the person has, allows you to compare it between other people so you can see the mutations. The CDC has put out a statement that they want the contractors to have this capability done within 30 days. And we can show you that right here. It says greater than or equal to 80% of functionality must be operational within 30 days of the kickoff meeting. And what's gotten even more intriguing is that this contract is now hidden. You can't find it looking for the solicitation number. You can't find it searching for Ebola. In fact, let me show you here. I'll search for the solicitation number, and no items found. Search for Ebola, you won't find it either. We do have a link for this on our website, so you can find it directly. But what it is it says the RFP solicits services for an urgently needed, rapidly deployable web-based IT platform that can integrate, manage, analyze, visualize, report on, share epidemiological laboratory, mortality, contact tracing, and traveler screening and other data related to support public health response activities during Ebola or other viral hemorrhagic fever modules in the United States. 80% done within 30 days. Now, people go, well, why should we even be scared of Ebola? People don't get it. It's hard to get. The vaccines are working. Well, fact is there are many threats with it. Let's go first with the vaccines. The vaccines aren't working. Contrary to everything you hear, I can show you very easily why the vaccines aren't working. And it comes from this solicitation for these vaccines. This is basically dealing with the Ebola vaccines. And let us look at what it says in here. When we search for, this is how they will conduct the efficacy of this vaccine. Let me zoom in here a little bit. That's how important this is. Efficacy. The government will evaluate data for in vivo activity with at least 60% of survival against a challenge of greater than or equal to 10 PFU foreign exposure. Let's look at the other one of this. Challenge level. The challenge level is 10 plaque-forming units PFU for an aerosolized exposure. 10 PFU. Most people on this planet have no idea what that means. In the case of Ebola, that is 10 virus particles. Now, why are we concerned about this? Well, all the other previous Ebola work that's been done by the military and the government, the challenge level was 1,000 plaque-forming units, 100 times greater. And basically what 1,000 plaque-forming units works out to be, that is what a person would experience from a needle prick with an Ebola-laced syringe, or somebody accidentally rubbing their eye with a little bit of Ebola on their finger. Roughly, it's 1,000 PFU is the amount of Ebola virus found in 1 cubic millimeter of Ebola-infected blood. So they've dropped this challenge level down to by 100%. They're doing this because none of the vaccines can protect against even the smallest challenge. 10 plaque-forming units kills 100% of monkeys. They're looking for 60% survival rate out of this. If they set it up to 1,000 plaque-forming units, none of these vaccines work. So the question is why have they dropped it 100-fold? Well, it could be because they just want to give these vaccine-making companies money. Could also be it's purely public relations. They want to tell the public, hey, look at this. We've got these Ebola vaccines out there working. They've passed our tests. We're past our aerosol challenge tests. Well, if you follow the Potter Blog site, and we'll have other links to this where you can actually hear them talking about this in their filovirus vaccine meetings. The virus basically can't defeat even the vaccine can't defeat even the most minuscule exposures to the virus. Now, the other thing people think is, well, thank goodness Ebola can't be spread via airborne route. Well, the challenge here is for an aerosolized exposure. As it turns out, the U.S. military believes that Ebola can spread just like the flu through the air. The reason we don't see it spreading that way in equatorial Africa is because it's hot there. Just like we don't get flu spreading in the summer, hot air doesn't work well with aerosol exposures. The other thing, the entire CDC safety net to try to prevent Ebola from coming into this country, it is based on not somebody who's recovered from Ebola, but rather somebody who actively has it. A person who has Ebola and is spreading it as a sexually transmitted disease, that person will completely slip through every CDC protocol designed to detect Ebola. And if somebody like that comes in and spreads Ebola via STD, especially if it spreads, if they infect somebody orally, that can result in Ebola spreading via exhalation prior to the person even feeling sick. And that's because the first cells infected would be in the oral and lung cavities, basically. So there's a whole heck of a lot to worry about here. And it doesn't even require a massive outbreak in this country to shut down the medical system. A few people shutting down a few hospitals, and basically the whole medical system collapses. Big concern. So where is the threat coming from? Well, you can see that too if you look through this Federal Register. They let people know when they have to change documentations to ask people questions. And what we have here, CDC is requesting an additional 6,814 respondents to the United States Travelers Health Declaration, French translation guide. In short, what this means is the CDC thinks the next Ebola outbreak entering the United States is going to come from the French-speaking parts of Africa. Why and they're also decreasing the risk from the English-speaking parts of Africa. So what's the difference here? Why greater risk from the French-speaking parts of Africa versus the English-speaking parts of Africa? Well, that's because usually the French-speaking parts of Africa are Islamic. And the threat there doesn't necessarily need to be Islamic terrorism, but there are cultural and religious aspects to Islam in terms of handling the dead that are much more difficult to overcome than the non-religious cultural things that are happening with handling the dead in the English-speaking parts of Africa. So, next big Ebola outbreak in Africa, French-speaking parts of Africa is where they're expecting it. And you can see the date of this when this came out was 12/17. So it's been about a month exactly. And as we happen to know, Ebola is outbreaking now in the French-speaking parts of Africa. They expect, I believe, to track approximately 8,000 people entering the United States who potentially have Ebola. Yes. So, a lot to be concerned about. Of course, nothing may happen. Could be another 10 to 20 years before things happen. But one thing is very clear. What the herd is being told about Ebola and what's actually going on within the government and preparations for it, two separate things.